Imagine a world where the white-clad guardians of the Hippocratic Oath, the very people we trust when we are at our most broken state, turn their scalpels, stethoscopes, and moral compasses away from healing and toward the service of a monster who trafficked young women and girls as if they were pieces of upholstery, used them until threadbare, then tossed onto the curb. This isn't a dark fantasy set in some feudal dark ages. This is the bleak reality found within the recently unsealed Epstein Files, as reported by the New York Times. Elite physicians, men from Mount Sinai, Columbia University, and prestigious West Palm Beach practices didn't just treat Epstein, they served him. They stitched up his victims on his dining room table. They diverted lab results to his inbox instead of to the patient's. With a chilling clinical detachment, they asked the master just how much dental work he wanted to authorize for a girl whose teeth were rotting from years of neglect. Picture the scene. A plastic surgeon from Mount Sinai, one of the New York's crown jewels of medicine, arrives at Epstein residence. There, on the same table, where one would expect fine china and silver cutlery, he closes a head wound on a young woman with 35 stitches. No sterile theater, no anesthesiologist on standby, no institutional oversight. Just the financier's living room, likely still thick with the scent of the previous night's excesses. The photograph exists courtesy of the Department of Justice. Face is obscured, but the gesture unmistakable. Medicine performed as a concierge favor for a sex offender. To put it in perspective for the non-medical people, 35 stitches implies a massive 10 to 14-inch gash. The idea of addressing such a trauma on a kitchen table makes any real doctor shudder in horror. Not speaking about the fact that we do not know, and we may never know anything about how such a horrendous wound even happened. Then there is West Palm Beach internist. He orders blood work for one of Epstein's women. When the results come back abnormal, perhaps anemia, perhaps something more sinister, he doesn't call the patient, he reports directly to Epstein. The sacred wall of patient's confidentiality is simply bypassed. The woman isn't the client. Epstein is. And what about the dentist from Columbia University? Columbia, the bastion of higher learning, where primum non nocere, first do no harm, is etched into the very soul of the curriculum, asks the patron the ultimate question: how much work do you want us to do on this girl with the severe cavities? Not how can we best restore her health, not what is her consent, but how much, as if her mouth were a kitchen renovation project being budgeted by the landlord. These were not isolated lapses in judgment. Epstein cultivated a stable of these specialists. He used them for his own mundane needs, the bad back, high cholesterol, the inevitable scripts for ED medications, and he used them for the women he exploited. Pelvic exams, liposuction, mole removal, $800 an hour psychiatry sessions, root canals, all bankrolled by the man holding them in sexual servitude. And when he grew bored of one, or when a $600 bill for acne medication, pretty much pocket change to him, hit his assistant's inbox, the reply was curt: ignore. What are we to make of this? That the ethical pillars of the profession, consent, privacy, independent judgment, were snapped not by back-alley quacks, but by the medical elite. That the very institutions that teach doctors to resist big pharma or overbearing families offered no shield against the gravitational pull of Epstein's money, his connections, and his unspoken threats. These doctors didn't have power. They had the illusion of power that comes from being adjacent to a man who moved among presidents, princes and professors, as immorality were a negotiable fee. They took his referrals, his gifts, perhaps his donations, and in exchange they performed house calls on his victims, treating them not as autonomous human beings, but as livestock on a rich man's estate. This is the banality of complicity in its purest form. There was no mustache-twirling villainy here. They were simply helpful. A stitch here, a lab results there, a dental plan adjusted to the patron's specs, and all the while these women, trafficked, used, discarded, were patched up just enough so they could continue to be used. Epstein is dead, of course, swinging from a bedsheet in his cell, or so the story goes. But the doctors remain, the institutions remain, and the question lingers like smoke in an empty room. How many other such stables exist, quietly maintained by the wealthy and the wicked, where medicine is used not as a tool of mercy but of control? We flatter ourselves that civilization is advancing because science and ethics walk hand in hand. Here is the counter-proof. The white coat can mask moral cowardice as easily as it masks a bloodstain, that the oath to do no harm can be whispered in one breath and ignored in the next, when the patient isn't the girl who is hurting, but the man who made her hurt. So the next time you hear a physician invoke the Hippocratic ideal, remember this farce from the Epstein Files. Remember the dining table turned operating theater. Remember the blood test funneled to an abuser. Remember the dentist who didn't ask what the patient needed, but what the predator wanted. And ask yourself, if these are the elite guardians of our health, what is the true price of their discretion? What horror do we tolerate as long as they are committed behind closed doors, on private tables, for private clients?